Vande Mataram.
Good afternoon and welcome to Midday Prime. I'm Shreya Upadhyay. As India continues her fight against coronavirus, your channel Doordarshan stands with you in these testing times, and that is why we're all wearing masks to stress more and more on how important it is for all of us to mask up even indoors now. We're in this together and we will battle it out together. Now, in the next 1 hour, we'll get you a complete roundup of the COVID-19 situation from across the country, the progress of the vaccination coverage, and of course, more on the final phase of voting that is underway in West Bengal. This and much more up ahead, but first, let's get you the headlines that we are tracking at this hour. International community continues to support India in the fight against COVID-19. 40 nations pledge their support. Second batch of 120 oxygen concentrators from UK reached Delhi today morning. Medical aid from US worth $10 crore to start from today. Supplies from Russia and Germany also reach India. More than 15 crore vaccinations administered so far. Countrymen continue to voice their support for the third phase of vaccination. COVID app sees over 1.7 crore citizens register themselves so far. Over 3,79,000 corona cases reported in the last 24 hours. States impose strict restrictions to arrest the surge in coronavirus cases. 4-day lockdown in Goa from today. Ongoing lockdown extended in Jharkhand by a week. And Bihar and Jharkhand extend the duration of night curfew from today. Prime Minister Modi reviews Indian Army's preparedness and initiatives for COVID management. Chief of Army Staff General M.M. Naravne informs that medical staff of Army is being made available to various state governments. Indian Army also setting up temporary hospitals in various parts of the country. Char Dham yatra suspended in view of the rising cases of COVID-19 in Uttarakhand. Chief Minister Tirth Singh Rawat makes the announcement, adding that only priests will perform the puja. And voting in 8th and final phase of West Bengal Assembly elections underway amid COVID protocols, counting to be held on the 2nd of May. All right, let's begin this bulletin with the big news that we are tracking. As India battles its worst COVID-19 surge, the world community has come forward to lend a hand of support and cooperation. 40 nations, including immediate neighbors, have pledged their support in the form of critical equipments and medicines to India.
We have actually received offers of assistance from various governments. We've been, actually there has been quite an outpouring of I would say solidarity with India. There's been outpouring of, let's say, assistance from various countries. Over 40 countries have actually committed to provide us with many of the items that we need most urgently.
And India has set its priorities clear, and liquid medical oxygen and drugs in shortage top the list.
We have, as I mentioned, prioritized certain areas. I think oxygen, liquid oxygen is one of the areas that has been a priority. We've also seen the requirement for anything that produces, equipment that produces oxygen, oxygen generators, oxygen concentrators, oxygen producing equipment, cryogenic tankers, transportation equipment for oxygen. We've also needed some urgent pharmaceutical products like remdesivir and tocilizumab, which is also a drug that is quite urgently required. Although we produce remdesivir, but given the requirements, obviously the production has not been adequate to meet the immediate shortfall.
Well, the cooperation is an all-encompassing effort to bolster the health infrastructure and supply essential drugs to India. The cooperation will be at multiple levels.
One is that we are looking at government-to-government sourcing. In other words, government has an empowered group, which is empowered group 2. This group has been engaged with seeing how we can quickly source, bulk oxygen, bulk liquid oxygen, etc. And they've done some very commendable work in getting some immediate results in that area. The second is an area in which we have actually received offers of assistance from various governments. The third area is in terms of procurement by Indian corporates. Many of the larger Indian companies have who are already very integrated into supply chains globally. The fourth area is international corporates. In the US, for example, a very large number of corporates have come together under the auspices of the State Department and some government facilitation to offer assistance through their own resources. And finally, Indian community associations, individuals who have, I think from all over the world come forward to say that what can we do to assist.
Well, the Foreign Secretary also said that the priority would be to ensure quick and hassle-free clearance of the incoming aid.
Our objective is to ensure that we channelize all of this assistance that is both sought by us and being received in a manner that is as effective as possible. In other words, how do we receive it? How do we ensure that we facilitate quick clearance? And not only that, we ensure that all of this is taken to different parts of the country where it is needed most critical areas. In that context, of course, we have had very strong interministerial and interagency cooperation. Cabinet Secretary has been overseeing this process himself.
Well, amid India's ongoing fight against COVID-19, the global community has lent India a helping hand. The first batch of emergency humanitarian aid to India arrived in New Delhi. 2 flights operated by Russian Emercom arrived in India today. Russian humanitarian assistance includes oxygen concentrators, lung ventilation equipment, bedside monitors, medicines including coronavir and other essential pharmaceutical items. Russian ambassador to India, Nikolay Kudashev, expressed hope that today's delivery of the Russian humanitarian assistance will become an effective contribution to the Indian government's efforts to provide emergency treatment to those who were affected by COVID-19. He also said that the cooperation also includes forthcoming deliveries of Sputnik V starting from 21st of May and subsequent facilitation of its production in India, cooperation in the field of medical science.
Arrived here today. These are oxygen concentrators, lung ventilation equipment, bedside monitors, medicines including coronavir, and other essential pharmaceutical items. Joint fight against the coronavirus threat is one of the most important areas of our cooperation at present. It also includes the forthcoming deliveries of the Sputnik V vaccine starting from May 2021 and the subsequent facilitation of its production in India.
Well, cooperation with United Kingdom also continues. Another shipment from UK containing 120 oxygen concentrators arrived early this morning. The UK has said that it will send further vital oxygen equipment to India in support of the country's fight against COVID-19. 3 oxygen generation units will be sent from surplus stocks in Northern Ireland to support India by providing more oxygen to those suffering from COVID-19. The oxygen units are each capable of producing 500 litres of oxygen per minute, enough for 50 people to use at a time. Now, this follows the UK's recent action to support India with 495 oxygen concentrators and 200 ventilators being sent from surplus stocks. The first batch of these medical supplies, remember, arrived in Delhi around 1 a.m. on Tuesday, that is 27th of April. British Minister for Middle East and North Africa, James Cleverly, said that Britain will provide India with 3 mobile oxygen factories to support the country's battle against its second wave of coronavirus infections.
We are also providing 3 mobile oxygen factories, each of which can provide or produce 1,500 litres of oxygen per minute, and that will help support India in its fight against coronavirus. We're responding to what India has asked for. I know our Prime Minister and the Indian Prime Minister will be speaking in the next few days, and we will continue to liaise with India to find out what they need and what we can do to provide ongoing support as they fight this terrible disease.
Well, in the fight against COVID-19, United States is sending supplies worth more than $100 million to India to help it fight a surge of COVID-19 cases. The White House in a statement said that the supplies, which will begin arriving from today and continue into next week, include 1,100 oxygen cylinders, 1,700 oxygen concentrators, 15 million N95 masks and 1 million rapid diagnostic tests. Now, the United States also has redirected its own order of AstraZeneca manufacturing supplies to India, which will allow it to make over 20 million doses of COVID-19 vaccine, according to the White House. And the first consignment of oxygen concentrators from Germany also arrived in Delhi today. Earlier, German Chancellor Angela Merkel had expressed her sympathy over the terrible suffering that the pandemic had brought to India. Meanwhile, Bangladesh has also offered emergency medicines and equipment to India to fight the COVID pandemic. Bangladesh is ready to dispatch approximately 10,000 vials of injectable antiviral, oral antiviral, 30,000 PPE kits and several thousand zinc, calcium, vitamin C and other necessary tablets for the people of India on an emergency basis in view of the corona situation in India. Now, expressing deep sorrow and condolences at the loss of lives in the country due to the spread of the COVID pandemic, Bangladesh expressed solidarity with India. It said at this critical moment, Bangladesh is ready to provide and mobilize support in every possible way to save lives. Well, White House National Security Advisor to U.S. President Jake Sullivan said that the United States is determined to help the people of India. In a tweet, he said, and I quote, "The United States is determined to help the people of India. We will continue to stand together in our shared battle against COVID-19, unquote. In fact, that's what Jake Sullivan said, that the United States is determined to help the people of India and they will continue to stand together in this shared battle that the world is seeing against COVID-19. And the Indian ambassador to United States, Taranjeet Singh Sandhu, said that the administration in United States as well as private sector are undertaking special sorties to send oxygen-related materials that are required in India.
The first supply has already taken off today and subsequent sorties will be taking place. There are a number of areas especially relating to oxygen, therapeutics, particularly remdesivir and its different variants. The kind of stuff that is needed is being supplied and it is being done as it is being assembled, it is moving. Now that is the administration side. On the private sector too, FedEx and a number of private companies are undertaking special sorties which will take the equipment and the oxygen related stuff, etc., which are required in India, would be ferried by these private companies.
Okay, let's talk a little bit more on this and try and understand the situation. My colleague Abhishek Jha is joining me live on Midday Prime. Abhishek, good afternoon. So really, yesterday, in fact, I remember Singapore had said that last year India had helped the world and it had supplied medical supplies and all the requirements that are needed to battle COVID-19. And now we are helping India with all its needs during this tough times that it is seeing. So really, as much as it makes us proud, it also reflects that India's, that essence, that belief that we think that the world is a global community in that sense of Vasudhaiv Kutumbakam. It is really coming to fruit, and we are seeing that international countries, international community, 40 nations, they have pledged their support, and more people, more and more countries are sending what is needed right now in India.
Of course, Shreya, and we have to also see that actually this is what India has worked on in the last 8-10 months, at least in front of COVID. If we talk about, otherwise there is large goodwill about India across the globe, that how India has helped entire world. Almost 150 odd nations were helped by India's, drugs, medicine, or PPE kits, or any accessories that were wanted by frontline workers in order to treat COVID patients. So in the last 1 year, India was at the forefront of helping the world. And now when India has seen an unprecedented surge in last few weeks only, the world is actually replying and reciprocating to the call of Indian authorities and Indian government that they are in need of help.
Yes.
There has been certain help from the countries where India has sought help from, and there has been also offer from countries where India may not have expected, but then there has been an approach that we are ready to help you in whatever you need. So Indian mission across the globe are actually trying to ramp up the procurement that India is actually needing at this point of time, especially all those machines, therapeutics, drugs, oxygen, liquid oxygen cylinders, and everything that currently we are seeing that Indian health care sector is in great demand. So everything is being well coordinated at the highest level, and we can hope that in the days to come more support from the global community we will be seeing.
Abhishek, also quickly, United States is expected to start sending the medical supplies that we need here. When can we expect that? And, it of course costs, thousands of dollars. So what really is included in all of that that the United States is sending here?
So United States is sending here medicine, drugs, therapeutics, especially all those, medicine that is actually needed by the patients at this point of time. Ventilators, machines, and other oxygen plants have also been being sent from USA. There are other needs, $100 million worth of other accessories are also being sent, and flights are en route. Like few have landed and few are en route. The same is case with Russia also, where one flight landed today morning, and we are expecting another 2 or 3 flights in the next 2-3 days. France has also sent is also sending their shipment of goods, which is needed by Indian authorities and the healthcare workers right now. So all across everything that is currently needed is being sent by the world. And meantime, India is also trying to ramp up its facilities and production capacity so that a long-term solution of this crisis can also be addressed.
Okay, and Abhishek, today morning also we did see supplies from Germany coming in. Russia, of course, sent its medical supplies. So really, and in fact, even smaller countries around the Southeast Asian region, whether it's Bangladesh or Mauritius, they've really pledged their support and they've sent medical supplies to India. So really, really reflecting, of course, the fact that we are in all of this together, and we have to fight it together. It doesn't matter whether you're a small country or you're a big country. We have to come together and fight the battle that we are fighting right now. And now we've entered the second year into it.
Of course, Shreya, and we have to also see that we are talking about big countries like USA, UK, Germany, France. But then there are countries like Romania, countries like Guyana, countries, even Bhutan, which has helped with oxygen plant that is just nearby across the border from Assam in our northeast states. So every country, small or big, is trying to help out in this hour of crisis, because one has to also concede the fact that this is not the fight that India has to fight alone. This is a fight that every country needs to put all their might together in order to save the world, because this is not the first wave or second wave that is going to end our fight against corona pandemic. Maybe some other geographical location will still be infected with the virus, and that virus can spread across the globe in like maybe another 3-4 months time. So as long as there's still maybe in a figurative term, even if one person is still infected with the virus across the globe at any point of at any place, our fight should not be accomplished. And this is the larger, broader agreement that world countries across the globe has that this is the fight that we have to fight together, and every country should pick in their support.
Absolutely, it's a global family, it's a global community, and we are in it together. We have to fight it together. Abhishek Jha, thanks very much for joining us with all those updates on 40 nations lending their support to India in its time of crisis. All right, moving on to our National Prime segment. All right, registration has opened for the third phase of vaccination, which is to be held from the 1st of May. CoWIN digital platform continues to work without any technical glitch on the first day of registration of the expanded eligible population groups. And today is, of course, the second day. Over 1.35 crore people registered themselves on the first day, and the total count has breached the 1.7 crore mark so far. In this phase, people above the age of 18 years will be vaccinated. Registration may be done on the CoWIN website or the Arogya Setu app. And now let us see how really the CoWIN portal works and how you can register for your vaccination.
On your browser's address bar, enter the URL selfregistration.cowin.gov.in. Enter your mobile phone number in the Enter Mobile Number field and click on the Get OTP button. You will receive a 6-digit OTP on the same number. Enter the 6-digit OTP that you received and click on the Verify button. Once you have registered your mobile number, you can register 3 more members on the same number if required. Click on the Register Member button. This will take you to the Register for Vaccination screen. On this screen, select the type of photo ID proof from the drop-down menu that you would like to register using. Please note that your photo ID will be verified at the time of your vaccination appointment. Please make sure that you provide the details of a photo ID that you will carry for the vaccination. Once you have selected the photo ID proof type from the drop-down menu, enter the relevant ID number in the field below. If your birth year validates you as 18 years of age or above, click on the Register button to complete the registration process for the beneficiary. An individual registered successfully prompt will appear on your screen. This will take you to the account details dashboard, where you have been added as a beneficiary. To add more members, you can click on the Add Member button on this screen and follow the same process using the new member's relevant details and photo ID. Now let's schedule a vaccination appointment. Under your details, you will now be able to schedule an appointment for your first dose. Click on the Schedule button and then click on the Schedule Now pop-up at the bottom of the screen. You can also schedule an appointment for more than one member by clicking on the Schedule buttons next to their names and then clicking on the Schedule Now pop-up at the bottom of the screen. Please note that to add multiple members for the same dose 2 appointment, the vaccine and dose 1 date for all must be the same. After clicking the Schedule Now pop-up, you will be taken to the Book Appointment for Vaccination screen. On this screen, you can find the nearest vaccination center by entering your area's PIN code and clicking on Search. Alternatively, you can also search vaccination centers by district. This will list out all the vaccination centers in the selected district with information about the vaccination centers such as the vaccination center's PIN code, the minimum age allowed at the vaccination center, the type of vaccine and the cost of vaccination if it is a private vaccination center, and the number of vaccination slots currently available on each date. Please note that you won't be able to book an appointment at a vaccination center that does not cover your age. Once you have found a suitable vaccination center with available slots on your desired date and vaccine type, click on the button that shows the number of seats available for that particular vaccination center. This will take you to the time slot selection, where you can select a vaccination appointment time that is convenient for you. Your vaccination appointment has been successfully booked. You will be able to see the booking information on the confirmation screen. If you wish to download the appointment slip, click on the download button and save it on your computer. If you would like to reschedule a vaccination appointment, you can click on the reschedule button next to the member's name and change the date and time of the appointment. If you have already received your first dose, the due date for your second dose will be shown next to your name on the account details dashboard. To download your vaccination certificate, click on the certificate button next to your details. If you have received only one dose, you will be able to download a provisional vaccination certificate. And if you have received both your doses, you will be able to download the full vaccination certificate.
All right, at this point, we're heading for a short break, but after the break, we get to you the latest COVID numbers from across the country. Stay tuned.
खुश है ये आसमां ज़मीन हर तरफ छाए हैं हम ये ऐसी कूल है अपनी कहानी चिल करके जीनी जवानी चलने दे बस दिल की मनमानी I'm cool chill your दिल I'm cool chill your दिल I'm cool chill your दिल.
Welcome back to Midday Prime. Now, India continues to report a rise in new daily COVID cases. The country reported 3,79,257 cases of COVID-19 in the last 24 hours, taking the cumulative data to cross 1,83,76,524. With 2,69,507 recoveries registered in the last 24 hours, India's recovery rate stands at 82.1%. India's total recoveries from COVID-19 have reached 1,50,86,878. Now, India's total active caseload has reached 30,84,814. It now comprises 16.79% of the country's total positive cases. Meanwhile, the country continues to immune population against COVID-19. India has achieved another milestone in the fight against disease by vaccinating a total of 15,20,648 people so far. Now, out of this, 21,93,281 vaccines were administered in the last 24 hours. Now, the Chief of Army Staff, General M.M. Naravne, called on Prime Minister Narendra Modi today. They discussed various initiatives being taken by the Indian Army to help in COVID management. General Naravne informed the Prime Minister that medical staff of the Army is being made available to various state governments. He also briefed the PM that Indian Army is setting up temporary hospitals in various parts of the country. General M.M. Naravne apprised the Prime Minister that Army is opening up its hospitals for civilians wherever possible. He also added that citizens can approach their nearest Army hospitals. General Naravne informed the PM that the Army is helping with manpower for imported oxygen tankers and vehicles where specialized skills are required to manage them. Meanwhile, Union Health Minister Dr. Harsh Vardhan, in fact, he visited the Lady Harding Hospital and interacted with the staff and relatives of the patients there. Later talking to the media, the Union Minister underlined the need to accept and religiously follow COVID-appropriate behavior in order to win the war against coronavirus.
कि सबसे बड़ा हथियार हमारे पास कोविड अप्रोप्रिएट बिहेवियर है। इस मास्क से बड़ा कोई हथियार नहीं है। ये कम से कम मैं व्यक्तिगत तौर पर भी 1.25 साल में समझ पाया हूं। तो बार बार देशवासियों को हर बार हम और हमारे प्रधानमंत्री जी इस बात के लिए आगाह करते हैं कि जो मर्जी करते जाइए, लेकिन ये कोविड अनुकूल व्यवहार मत भूलिए। 2 गज की दूरी को मत भूलिए। हाथ को साबुन से धोने की प्रक्रिया को मत क्षीण होने दीजिए, उसको मत भूलिए। और जितना ज्यादा संभव हो भीड़ के अंदर आप अगर ना जाएं, भीड़ को अगर ना क्रिएट करें, तो शायद वो हमारे सबके लिए लाभकारी है।
Dr. Harshvardhan also informed that the nation is continuously increasing the number of beds and trying to accommodate more patients in the fight against the COVID-19 pandemic.
ये भी आज एक बहुत महत्वपूर्ण निर्णय हुआ कि हमें, क्योंकि अपने ओल्ड बिल्डिंग में और ज्यादा बेड्स को क्रिएट करना है और ज्यादा बेड्स को क्रिएट करने के लिए वहां पर पहले ही लगभग 270 बेड्स हम लोगों ने पिछले दिनों में क्रिएट किए थे। आज उसमें 112 बेड्स का और इजाफा किया है और इसी तरीके से 30 बेड्स का इजाफा जो हमारा कलावती शरण अस्पताल है वहां पर बेड्स को एक प्रकार से रीअप्रोप्रिएट करके नॉन कोविड, और उसमें भी 30 बेड्स कोविड के लिए व्यवस्था की गई है।
And my colleague Taposh Bhattacharya is joining me from Delhi. He's been tracking all the COVID numbers and the vaccination progress in the national capital. Taposh, good afternoon. First, let me get straight to the vaccination progress. Yesterday, we saw there was, more than 1.35 crore people registered themselves for the vaccination that opened up for people who are above 18 years of age. And so far, that number has crossed the 1.7 crore mark. So really, more and more young Indians coming up and registering themselves for their first dose of vaccination in this fight against COVID-19.
Yes, you're bang on there that at the start of yesterday, 1.37 crore was a figure by the end of the day that we were given by officials, and it is expected that already by 11 o'clock, the figure has touched on a particular one day 33.2 lakh crore, and it is expected that by today evening it is expected to cross 50 lakhs, and overall, as of now, the figure of till 11 o'clock, if I tell you, it is 1.7 crore. So that what it shows that there is a tremendous amount of faith that the young India has shown in India's vaccination program, debunking any sort of a myth or any rumors that was there. They have debunked those. They have fully pushed themselves, registered themselves, and now the ball is in the state government's hand, where they have to now speed up the vaccination program. And it is very important, in this fight against pandemic, it is very important to have the vaccination process vaccinate yourself. Because just to give you a perspective, what I'm trying to tell you is that if you get yourself vaccinated, the chance of getting infected, the chance of getting others infected goes down substantially. And this is not just me. I'm talking about a study by the Public Health of England. It's still not peer reviewed, by the way, but it's been published by Public Health England that if you even have a single dose of COVID-19 vaccine, be it any vaccine for that matter, your virus transmission risk is cut by almost 50%. And the research also shows that different viruses, different vaccines, be it AstraZeneca, be it biotech, be it Covaxin, or any of these particular vaccine if you have got and if you got one dose and have got a 3-week in between time, you're likely to have 38 to 49% likely to infect other household members vis-a-vis who are unvaccinated. And also, the study also shows that the risk of symptomatic infection was also reduced by 60 to 65%. So what it shows is that if you get yourself vaccinated in due course of time, your infection rate, your infection giving to others also reduces manyfold. And that's one of the reasons why even in this particular second wave, you are watching that the fatalities of the senior citizen in comparison to in the first wave is less than what it is. In fact, this time the young generation or the youngsters, let's put it at the age of 20 to 40 or 45, have been have to bear the brunt of this particular second wave. So
That's right.
it is imperative that once the jab starts, each and every individual responsibility to go out there and get themselves vaccinated if we want to fight and get rid of this virus once for all.
Absolutely, Taposh. Like you said, more and more young adults and children are getting infected in this wave. And of course, we know that a lot of us are asymptomatic and we could be carriers. We could be, infecting people around us, our loved ones. So we have to be really careful and of course, get ourselves vaccinated as soon as possible. Now, Taposh, coming to the numbers, what is the latest ground situation in Delhi today? We know that Delhi has been, one of the worst affected in the country when it comes to the rising number of cases. What is the status today?
Shreya, let me put it this way, that hardly much of a change has taken place. In fact, the health infrastructure of the national capital has actually, crumbled. If I won't be wrong to say that it has crumbled. In fact, we've been told that yesterday around 12 o'clock, after 12 o'clock, in fact, the Delhi Health Bulletin came out. There was a lot of discrepancies, and when we raised the issue that there was a lot of discrepancies in those numbers, in the morning they again came out with the correct numbers. And let me tell you, just giving you a perspective of those numbers, yesterday in the last 24 hours, 25,986 cases came out, and the test conducted yesterday after a long time was over 80,000. And remember, 80,000 is not a great number because earlier we have seen the test results somewhere in the region of 90 to 1 lakh. So basically the test in the last 1 week has gone down, but even then 80,000 is better than in the last few days. The other part that is very important is that there is, in the last 1 week, the fertility rate is still over 300. In fact, yesterday also the fertility rate was 368. And what it shows is that the positivity rate has actually been over 30% for the last more than a week now. It's almost 31.76%. And if you break down the testing also, you will realize that the RT-PCR, which is considered the golden set of testing in the country, there's only 50. What I can tell you is that only 55,000, just over 55,000 tests were done of RT-PCR. Rest were rapid antigen tests. So the numbers tell you a story that there is a massive COVID situation in the country, in the national capital. The only way to fight this is to go ahead with the COVID protocol behavior. The only problem that the Delhi government could not control, and that's where the problem started at the very beginning, is that in the last month, starting the last month end and in the beginning of this particular month, the people stormed the markets and they didn't follow the COVID protocol, and that is where the problem lies. Even in this particular time, it is imperative that in the lockdown, one follows the COVID protocol behavior. If one gets even slight symptoms, get themselves tested and get oneself isolated, so that not just you, but others can.
Right.
Don't get infected with
Absolutely,
the virus.
Taposh.
And that is the main thing. Delhi is currently reeling under this, probably the fourth wave, not the second wave of the country, but the fourth wave in the national capital. And they've been gasping for breath, gasping for oxygen. The center has been going all out to provide oxygen to the national capital. But somewhere down the line, the Delhi government. I know for a fact that a lot of hospitals are running short of oxygen. One of my relatives.
Right, so we'll have to see. We'll have to see how the situation pans out in the national capital in the next few weeks.
Taposh, national capital, and it is high time that the
Right, Taposh, we'll have to see how the situation pans out in the national capital and, of course, follow COVID-appropriate behavior, whether it's Taposh standing outside or me in the studio. We're both wearing masks, and that is something that we all have to follow, whether we are indoors or outdoors. Taposh Bhattacharya, thanks very much for joining us with those inputs from Delhi. All right, moving on, the Indian Air Force has also swung into action by carrying out sorties from various parts of the country to airlift oxygen containers and cylinders. 2 empty tankers for medical oxygen were airlifted to Ranchi from Agra. Indian Air Force's C-17 airlifted 4 empty cryogenic oxygen containers from Bangkok to Jamnagar Air Base. The IAF also airlifted 2 containers from Agra to Ranchi, 2 from Chandigarh to Ranchi, 2 from Indore to Raipur, 1 from Indore to Jamnagar, 2 from Hindon to Ranchi, 1 from Bhopal to Surat, 2 from Jodhpur to Jamnagar, and 2 from Gwalior to Ranchi. Now, what about the states? The state governments continue to roll out strict measures to combat COVID-19. Goa will undergo a lockdown for 4 days from today evening till the 3rd of May in order to curb the spread of coronavirus disease. Now, all essential services, including grocery stores, will remain open. Kitchens of restaurants will be open for home delivery of food. Public transport will be completely shut down. Goa Chief Minister Pramod Sawant has urged people not to panic buy. He also appealed to people to take necessary precautions against coronavirus and take medicines in case of COVID-19 symptoms. From Goa to Bihar, where the government has extended the period of night curfew by 3 hours from 6 p.m. till 6 a.m. from today. Now, shops and business establishments will be closed by 4 p.m. Essential services have been exempted from this order. The decision was taken by the Crisis Management Group, which was headed by Chief Minister Nitish Kumar. 50 people will be allowed for marriage ceremonies, while only 20 people will be permitted for a funeral procession. The government and private offices will be closed after 4 p.m. and 25% attendance will be allowed in offices. The state government will bear all expenses of funeral of those who died due to COVID and related diseases. Now, amid the surge in COVID-19 cases in Madhya Pradesh, the state government has extended the corona curfew in the state till 7th of May to break the chain of transmission. At present, corona curfew is underway in several districts of the state, including Bhopal, Indore and other prominent cities till the 3rd of May. The State Home Minister, Dr. Narottam Mishra, informed that the decision was taken by the Chief Minister in a meeting to review the COVID situation in the state along with the cabinet members. Dr. Mishra also said that the Chief Minister is monitoring coronavirus spread in some districts, including Indore, Bhopal, Gwalior, Jabalpur and Ujjain. Meanwhile, a much-needed relief has been sent to Bhilai. 3 empty tankers of oxygen have been airlifted from Bhilai to Bhilai from Indore in a bid to fulfill the rising demand of oxygen for COVID-19 patients in the region. On to Karnataka, where Chief Minister B.S. Yediyurappa reviewed the lockdown situation in the state and interacted with district authorities. The Chief Minister stressed upon strict implementation of guidelines and restrictions which are unnecessary movement for people. He called for strict action without any hesitation if people were found violating rules. Meanwhile, Section 144 is imposed across the state. The police have seized over 100 vehicles yesterday as the riders were defying the curfew. And in Jharkhand, the government has extended the ongoing lockdown by another week till the 6th of May, along with more restrictions on the movement of people and operation of markets. Until now, shops and other trade establishments that did not come under the purview of the lockdown were allowed to function till 8 p.m, except medical services and pharmacies. Agriculture, industries and mining operations will function during this period. Religious places will remain open, but devotees in fixed numbers only will be allowed. Now, in other news, polling for the 8th and the final phase of West Bengal Assembly elections for 35 assembly constituencies is being held today. Polling began at 7 in the morning and it will conclude at 6:30 p.m. in the evening in 11,860 polling stations in the state. 84.77 lakh voters will decide the fate of 283 candidates in today's round of polling. 37.8% polling has been registered till 12 noon. And the counting of votes in West Bengal, Assam, Tamil Nadu, Kerala and Puducherry will take place on the 2nd of May. Meanwhile, as always, Prime Minister Narendra Modi urged voters to cast their vote and enrich the festival of democracy. In a tweet, PM Modi said, and I quote, "Last phase of the 2021 West Bengal elections takes place today. In line with the COVID-19 protocols, I call upon people to cast their vote and enrich the festival of democracy," unquote. And to get us more on the final phase in this marathon elections in West Bengal, I am joined by my colleague Anibrato. Anibrato, good afternoon. The last phase of the West Bengal Assembly elections today, we've seen that the last phase, the penultimate phase, in fact, the previous one was more or less, not violent. But the previous, other than that, all right, we are... Right now, we are unable to connect with Anibrato. We'll try and reconnect with him as soon as we can. But moving on, in the wake of the rising cases of coronavirus, the Uttarakhand government has suspended the Char Dham yatra this year in the state. Issuing an order, Chief Minister Tirath Singh Rawat said that only priests of the 4 temples will perform rituals and puja this year.
चार धाम यात्रा को लेकर के अभी जिस तरह कोविड है तेजी से बढ़ रहा है उसको देखते हुए स्थगित किया जाता है और साथ ही केवल पुजारी वही वहां पूजा पाठी करेंगे, बाकी कोविड को देखते हुए सभी मैं कह सकता स्थगित इसको हम कर रहे हैं.
All right, after that in Midday Prime, it's time for news and updates from the world of business. All right, the domestic stock markets have posted moderate gains on Thursday. The Sensex at the BSE had advanced 206 points or 0.2% to 49,940 a short while ago. The Nifty at the National Stock Exchange had climbed 71 points or 0.5% to 14,935. In the broader market, the BSE Mid-Cap Index has added 0.1%, while the Small Cap Index has advanced 0.3%. The top index gainers are JSW Steel, Tata Steel, Bajaj Finserv and Bajaj Finance with gains of between 3 and 7%. The top index losers are Hero Motocorp, SBI, Eicher Motors and Mahindra with losses of between 1.2 and 1.5%. All right, with that, let's now take a look at what's making news across the globe. Well, starting with the United States, where President Joe Biden delivered his much-awaited speech to the joint session of the Congress at the Capitol. Joe Biden urged the Congress to enact police reform in the name of George Floyd. Biden told a joint session of the Congress that the reform was broadly supported by the American people and lawmakers should work together to wrap up what he called the productive discussions between Democrats and Republicans on the issue.
To root out systemic racism in our criminal justice system and to enact police reform in George Floyd's name that passed the House already. I know Republicans have their own ideas and are engaged in the very productive discussions with Democrats in the Senate. We need to work together to find a consensus. But let's get it done next month, by the first anniversary of George Floyd's death. country supports this reform, and Congress should act. We have a giant opportunity to bend the arc of the moral universe toward justice, real justice.
Well, Joe Biden also reiterated that he welcomed competition from China, but said that he would defend America's interests across the board.
In my discussion with President Xi, I told him, we welcome the competition. We're not looking for conflict. But I made absolutely clear that we will defend America's interest across the board. America will stand up to unfair trade practices that undercut American workers and American industries, like subsidies from state to state-owned operations and enterprises, and the theft of American technology and intellectual property.
Now, U.S. President Joe Biden's address to Congress broke a historic glass ceiling on Wednesday as two women, Vice President Kamala Harris and House Speaker Nancy Pelosi, sat behind the president for the first time in U.S. history. The seating arrangement carried a symbolic meaning for the advancement of United States women in recent decades, since Harris as well as Pelosi stand first and second in the presidential line of succession, respectively. Now, Biden spoke to a joint session of the House and the Senate with attendance restricted to enforce social distancing amid the COVID-19 pandemic. Harris arrived ahead of Biden, and Pelosi affectionately took the vice president's hand as she reached the dais before quickly switching to a pandemic-appropriate elbow bump. Harris, who is the first woman and the first black and Asian person to serve as the vice president of U.S., sat to Biden's right. Pelosi, who became the first woman Speaker of the House of Representatives in 2007, sat to his left. The two women are playing a vital role in the early days of the Biden presidency, with Harris as a close advisor and tiebreaker in an evenly divided Senate, and Pelosi helping to marshal the president's legislative agenda through the Congress.
Thank you all, Madam Speaker, Madam Vice President. No president has ever said those words from this podium. No president has ever said those words, and it's about time.
Well, Madam Speaker and Madam Vice President, that line is going to go down in history when it comes to women empowerment. All right, moving on, Apple has posted sales and profits far ahead of Wall Street expectations and announced a $90 billion share buyback as customers continued to upgrade to 5G iPhones and snapped up new Mac models with Apple's house-designed processor chips. Sales to China nearly doubled, and results topped analyst targets in every category, led by $6.5 billion, more in iPhone sales than predicted, and Mac sales about a third higher than estimates. Apple Chief Executive, Tim Cook said that the company sees an economic recovery coming. Mariabhutana, who was jailed in United States after admitting to working as a Russian agent, has applied to take part in primaries for Russia's ruling party to run for a parliamentary seat. Now, 32-year-old Bhutana pleaded guilty in December 2018 to infiltrating a U.S. gun rights group and influencing conservative activists and Republicans. Moscow said that the charges were ridiculous and she had been forced to confess. She was deported back to Russia in October 2019 after serving most of her 18-month sentence and welcomed home with pomp. Now, the election to the Duma, Russia's lower house, is scheduled for September, and we'll have to see how that pans out. All right, now it's time for all the updates, all the excitement from the world of sports. And my colleague Narayan is joining us to get us all the news from the world of sports. Narayan, over to you.
Thanks, Ria. Let's get started with some football action. Manchester City produced a superb second-half fight back to claim a 2-1 advantage after the first leg of the Champions League semi-final against 10-man Paris Saint-Germain in Paris. The Premier League leaders were stung by an early Marquinhos goal, and it was a very shocking for them, and they dominated the first half of a high quality match, and soon after it was looking like that they will go ahead. They responded brilliantly with Kevin De Bruyne equalizing after the 64 minutes and Riyad Mahrez firing home a free kick soon after. And to completely PSG miseries, former Everton midfield man Idris Gueye was rightly shown a red card late on for a dreadful challenge on the Ike Gundogan. PSG showed in the first 45 minutes exactly why nothing can be taken for granted by City, but former Spurs manager Mauricio Pochettino will know his side are underdogs in the fight to face either Chelsea or Real Madrid in the final in Istanbul on 29th of May. Meanwhile, in IPL, Ruturaj Gaikwad and Faf du Plessis' solid opening stand helped Chennai Super Kings beat Sunrisers Hyderabad by 7 wickets in an Indian Premier League match in Delhi. Gaikwad tore apart Hyderabad bowling attack during his 75 of 44 balls after du Plessis launched an initial assault, making a target of 172 looking easier than it actually was. The win was CSK's 5th on trot, which helped them leapfrog Royal Chennai Bangalore to the top of the table while Hyderabad stayed at the bottom. Meanwhile, today in Premier League, in the 24th match of the ongoing season 14, Mumbai Indians lock horns with Rajasthan Royals at the Arun Jaitley Stadium in Delhi. Mumbai Indians have had a very unsteady IPL 2021. They have registered 2 wins but have also notched off 3 losses. But they are a champion side, having won 5 titles, and they know how to stage comebacks. But the middle order's underperformance has caused a few headaches for the Mumbai franchisee. Rajasthan, on the other hand, have a lot of issues to ponder over, particularly in the absence of key foreign players Jofra Archer, Ben Stokes, Liam Livingstone and Andrew Tye. Now shifting focus to Formula 1. Formula 1 has confirmed a change to round 7 of the 2021 calendar, with Turkish Grand Prix replacing the Canadian Grand Prix for the weekend of June 11 to 13. Due to ongoing international travel restrictions in place in Canada, it became impossible for Formula 1 to enter the country without a mandatory 14-day quarantine, leading to the change. That's all from the sporting world. For more updates, back to Shreya.
Thanks very much, Narayan, for all the excitement from the world of sports. And now it's time for our next segment, which is Life Prime, where we bring you stories from the world of art, cinema, science and innovation. Stories that are bringing smiles, stories that are changing lives. Now, a video showing the crew of a doomed submarine singing a popular Indonesian hit song called Sampai Jumpa, or Till We Meet Again, has gone viral after it was released by the Indonesian Navy in the wake of a submarine disaster. Now, according to the Indonesian military, the crew was recording this song as part of a commander's farewell just weeks before. Well, at this point, it's a wrap in Midday Prime, but as always, a quick reminder for all of you to follow COVID-appropriate behavior, wash your hands, maintain social distance, and most importantly, use this, the biggest weapon, not here, but right here, where your nose and mouth are covered. So please wear your mask and wear it properly. With that, it's a wrap. But news and updates continue. Up next is Doctor Speak, where we clarify all your doubts related to COVID-19. Stay tuned and thanks for joining in right now. Namaskar.